Well, we finally made it to the end of the Nephron Fun Zone and Water Park. There was a lot of waiting in line, wasn't there? And then Thelonious Monk up on that high dive. Are you ever going to be able to unsee those unsightly chapped thighs? Ugh. Don't lose your appetite, though. It's time to head over to the food court. The Minerello food court, that is. In this final diuretic attraction, we're going to focus on diuretics that augment the activity of the mineralocorticoid aldosterone. Blocking aldosterone is especially useful in the management of heart failure. As we'll soon see, these agents, along with beta blockers and ACE inhibitors, can actually prolong life in these patients. Come on, I'm hungry. Let's head over there already. At previous locations in the park, the role of diuretics was to decrease sodium chloride reabsorption, or in the case of acetazolamide, decrease sodium chloride and sodium bicarb reabsorption. All this sodium left in the lumen instead travels down the renal tubule until it reaches the collecting duct at the end of the park. Take a look at the center of the food court. The terminal collecting duct is kind of like this gutter here that drains the entire park. I know, it's pretty gross. Just don't get too close. I promise, though, that all of these eateries have at least a passing grade from the health department, so we're good. Let's check out the dining options on this park map over here. Oh, look how far we've made it. We're now at the most distal end of the park, the end that has a striking structural resemblance to the collecting duct of the nephron. Let me give you a little background about this area of the park before we decide. The collecting tubule system is responsible for only 2 to 5% of sodium chloride resorption by the kidney. Despite this minuscule contribution, it plays an important role in diuretic action. As the final site of sodium reabsorption, the collecting duct system is responsible for tight regulation of body fluid volume and for determining the final sodium concentration of the urine. This last little bit of sodium, then, is the solute most relevant to diuretic action at this portion of the park. So, as this sketch develops, keep your eyes on those salty sodium peanuts. Wherever sodium goes, water goes too. Also, we'll be bringing back our recurring potassium bananas as well, because the collecting duct is the most important site for potassium excretion by the kidney. In fact, the changes in potassium balance that occur from any diuretic class is caused by electrolyte handling here at the duct. One more thing. By now, I'm sure you've noticed that the name of the food court, the Minerello food court, informs us that the collecting duct is the site of action of the mineralocorticoid aldosterone. Okay, I can tell you're getting hungry. I'll show you what I mean once we head inside. Let's start at the principal court and work our way around, shall we? Let the name principal court remind you that we're standing in the principal cell of the collecting duct. The principal cell is the major site of sodium, potassium, and water transport. All right, for our first dining option, yes, another one of those banana vending machines. Remember that the potassium banana vending machine powered by the 3P batteries is the recurring sketchy symbol for the sodium-potassium ATPase. Like at every attraction in the park, the sodium-potassium ATPase in the basolateral membrane pumps reabsorbed sodium into the interstitium in order to maintain a lower intracellular sodium concentration, making room for more absorption. Let this wide open area in the food court represent the intracellular compartment of the collecting duct. So bananas will be fine, right? No? Not feeling enough? Let's see. What else did they have? Where did that kid get those salty sodium peanuts from? Here we go. The food court at the Nephron Fun Zone is famous for its salty snack carts. These represent the epithelial sodium channels, or ENaC, responsible for sodium resorption. Just think ENaC snacks. These channels are located on the luminal membrane of the collecting duct principal cells, which is why these snack carts are located at the edge of that collecting duct gutter. Let the water running down the gutter represent the intraluminal space of the renal tubule, as these ENaC salty sodium snack carts distribute their salty sodium peanuts to the intracellular area of the food court. All right, there's another dining option up ahead. You're going to love it. It's more bananas. Notice that this banana stand is located at the apical membrane. It allows passage of potassium out into the tubular lumen, as depicted by these bananas toppling into the collecting duct. Look closely. The reason it's tipping into the tubular lumen is because it's getting smacked by that salty snack cart. Why is that snack cart guy being so aggressive? Well, let me tell you a little bit about their relationship. The mechanism of sodium chloride reabsorption here in the collecting duct is different than anywhere else in the park. The principal cells do not contain cotransporters. This is in contrast to the procart track, where we saw the H+ helmet exchange for the salty sodium peanuts, the loop-de-loop of Henle, where sodium, potassium, and 2 chlorides were absorbed, and the distal convoluted tube slide, where both sodium and chloride were getting scraped into those buckets. All these previous transfers were electrically neutral. Here at the collecting duct, it's only sodium that's transported by ENaC. This leaves behind a negative electrical potential in the lumen, which draws potassium out of the cells through that apical potassium channel. So remember, as that salty ENaC snack guy crashes into that banana stand, it's sodium absorption through ENaC that's forcing potassium secretion. It's getting a little heated over here, but don't worry, we have another dining option. You can't go wrong with food trucks, am I right? Ooh, intercontinental. Sounds sophisticated. Let the name Alpha Intercontinental Food Truck remind you of the alpha intercalated cells, also found in the collecting duct. Apparently you can go wrong with food trucks because look at all that acid waste spewing into the collecting duct. Hence the low pass health code rating I was warning you about. Let this acid pumping from the truck, powered by those 3P batteries, represent the proton ATPase located on the apical membrane of the alpha intercalated cell. The alpha intercalated cells are the primary sites of proton secretion at the collecting duct and are involved in acid-base homeostasis. You can't just dump acid willy-nilly into the gutter like that. Who's in charge here? Oh, there he is, the Minerallo food court man. He holds the key to this whole sodium reabsorbing, potassium excreting operation. The Minerallo food court man represents the intracellular receptor for the mineralocorticoid aldosterone. Aldosterone is a steroid hormone, so it first travels intracellularly to bind its receptor. At Sketchy, mineralocorticoids are represented by mineral crystals. So let this mineral crystal keychain in his hand depict aldosterone binding to its intracellular receptor. Now the food court guy can go around and upregulate transcription of certain genes. Think back to the mineral bar at the Ace Casino and recall that aldosterone is produced in the adrenal cortex as the final product of the renin-angiotensin-aldosterone system. Aldosterone works at the collecting duct, promoting sodium reabsorption and volume retention. How does it accomplish this? Well, notice the Minerallo food court man has inserted his aldosterone keys to activate certain ion channels and transporters. Aldosterone, through its actions on gene transcription, increases activity of ENaC and potassium channels on the apical membrane, as well as the basolateral sodium-potassium ATPase. This leads to an increase in the transepithelial electrical potential and a dramatic rise in both sodium reabsorption and potassium secretion. Notice too that the Minerallo food court key is also activating that acid excretion food truck. Yep, aldosterone also increases gene transcription in the alpha intercalated cell and increases the activity of the apical proton ATPase. Okay, as a way to take this all in, I want you to think back to 2 previous attractions, the loop diuretics and the thiazides. Both agents block sodium reabsorption, leaving it in the lumen. Well, sodium ends up down here at the collecting duct. Therefore, these agents indirectly activate all these mechanisms. Lupes and thiazides cause hypokalemia because they enhance sodium delivery to the duct, prompting potassium secretion. Not only that, the sodium reabsorption here causes a negative luminal potential, also facilitating H plus secretion. So they both can cause metabolic alkalosis. Also, lupes and thiazides drop volume, activating renin and aldosterone. So all these mineralocorticoid keys exacerbate this potassium loss and proton secretion. When you think of the side effects of the lupes and thiazides, just think of the collecting duct. Instead of enhancing all these processes, the diuretic agents I'm about to introduce work on the collecting duct to reverse these processes. In other words, these are your potassium-sparing diuretics. Just take a look. The parents aren't too happy about the food court's lack of healthy options and are taking matters into their own hands. The first target on their outrage is that overly aggressive, salty sodium snack cart. Let those healthier options of almonds and tangerines remind you of amiloride and triamterene, two potassium-sparing diuretics that inhibit sodium influx through the ENaC channel on the luminal membrane. This causes the sodium to stay in the tubular lumen. Just look at those salty sodium peanuts spilling into the collecting duct, pulling water with it to be excreted. And that increased luminal potential from those positive sodium ions, that means less potassium excretion, hence the potassium-sparing effect. And take a look over here at this angry teacher who's decided to attack the problem at the source. She's grabbing the Minerella Food Court key holder. She's a teacher, so she holds one of those cliche apples, of course. Let apple remind you of the drug eplerenone, a potassium-sparing diuretic that directly antagonizes the mineralocorticoid receptor. Notice that the mineralocorticoid key is now unable to bind. And it looks like she called in the authorities on this sorry excuse for a food court. Yep, it's the health inspector, here with his notebook, taking notes on the rampant health code violations, no doubt. Let the title of inspector, as well as his spiral-bound notebook, remind you of the drug spironolactone, another potassium-sparing diuretic that directly antagonizes the mineralocorticoid receptor. Disrupted gene transcription means decreased activation of the sodium and potassium currents at the apical membrane, which in turn means less sodium retention and less potassium wasting. So you've got natriuresis. Potassium-sparing diuretics are most useful in states of mineralocorticoid excess, also known as hyperaldosteronism, due to either primary secretion, seen in Conn syndrome or ectopic ACTH, or secondary hyperaldosteronism, seen in heart failure, hepatic cirrhosis, nephrotic syndrome, or other conditions associated with decreased intravascular volume. And if you look off into the distance, there's the iconic nephron fun zone mineral mountain. Let its abundance of salty minerals remind you of high mineralocorticoid levels seen in primary and secondary hyperaldosteronism. And let its crumbling facade remind you of the usefulness of potassium-sparing diuretics in these conditions. Let's say you're presented with a patient suffering from fatigue, muscle weakness, and occasional headaches. Is there an electrolyte abnormality at play here? Well, his blood pressure is 180 over 110. Okay, a lot of things can increase blood pressure. Then you take a look at his labs and you notice the potassium's low. Here's where it hits you. High blood pressure with low potassium sounds like the work of hyperaldosteronism. Other clues will be metabolic alkalosis, depressed plasma renin activity, or a CT scan showing an adrenal mass. This patient needs a potassium-sparing diuretic to counteract the effects of increased aldosterone. Back to one of those secondary hyperaldosteronism states, heart failure. Heart failure reduces renal blood flow. Reduced renal blood flow activates the renin-angiotensin-aldosterone system, which increases salt and water retention and exacerbates edema. Recall that those furious loop diuretics are first-line treatment, but they may cause excessive potassium wasting. Therefore, a potassium-sparing diuretic can be added to blunt the potassium excretion. In fact, mineralocorticoid receptor antagonists specifically, such as eplerenone and spironolactone, are recommended in some cases of severe heart failure with reduced ejection fraction due to their ability to block the deleterious effects of aldosterone on the heart. This causes regression of myocardial fibrosis and improvement in ventricular remodeling. Just look at this poor girl in the corner. Her birthday party ruined yet again by the overly health-conscious parents. Come on, what's the harm of a few salty peanuts? Notice her pitiful failing heart balloon, our recurring sketchy symbol for the treatment of heart failure. Also notice she's standing next to some remodeling, as a reminder of the ability of mineralocorticoid receptor antagonists to prevent the ventricular remodeling induced by high levels of aldosterone. Maybe they're building a new salty snack shack? And as we've seen with previous therapies that reduce cardiac remodeling, such as beta blockers and ACE inhibitors, this means reduced morbidity and improved survival in these patients. Increased survival is represented by the life-preserving guardian angel outfit attached to this innocent little birthday girl. All right, a couple more clinical indications of the potassium-sparing diuretics. Can you hear it? It's the endless trickle of the nephrogenic diabetes insipidus fountain. Recall from the distal convoluted tube slide section of the park when we discussed the thiazide's ability to treat nephrogenic DI, including in cases caused by lithium toxicity. Well, besides helping to blunt the effect of potassium-wasting thiazides, amiloride has been shown to be an effective treatment specifically in lithium-induced DI. Besides blocking sodium entry, it also blocks lithium entry into collecting duct cells. This means amiloride increases clearance of lithium. So, watch those lithium levels. Be sure to check out the Sketchy Farm video on diabetes insipidus treatment for more info. You know, gnomes get a pretty bad rap, don't they? Relegated to freak status when they're just trying to make a living like you and me. This little gnome snack cart employee, getting taken down by those parents, represents amiloride and triamterene use in the treatment of Little's syndrome. Little's syndrome is a rare autosomal dominant disorder that results in overactivation of the ENaC channels. By blocking these channels, amiloride and triamterene can correct both the hypertension and hypokalemia associated with the disorder. Let's discuss the side effects of potassium-sparing diuretics. First, look how happy that banana salesman is on this side of the collecting duct. The health crusade seems to be working. No aggressively salty ENaC snack cart means no interference of that poor banana stand and healthy potassium for everyone. Careful though, those raised bananas should evoke an image of the hyperkalemia seen with potassium-sparing diuretic therapy. The reduced renal excretion of potassium can cause mild or even life-threatening hyperkalemia. The risk of hyperkalemia is increased in renal disease when there is a decreased excretion of potassium and also with concomitant use of drugs that inhibit renin and angiotensin II activity, such as beta blockers and ACE inhibitors. This issue can be avoided by combining potassium-sparing diuretics with a potassium-wasting diuretic, such as thiazide, in order to balance their effects on electrolyte levels and acid-base status. Speaking of acid-base balance, it looks like that acid-spewing food truck is making a getaway before the rioting, health-conscious parents turn their attention toward all that acid pollution. Let that yellow acid spilling into the intracellular space instead of the collecting duct represent the side effect of non-anion gap metabolic acidosis caused by potassium-sparing diuretics. Inhibition of aldosterone decreases the activity of that apical proton ATPase, decreasing the kidney's ability to excrete acid. Also, inhibiting the salty ENaC snack cart leaves more sodium in the intraluminal space, diminishing that negative intraluminal potential that further facilitated proton secretion. This normal anion gap metabolic acidosis caused by inhibition of aldosterone's effects at the collecting duct is similar to a type 4 renal tubular acidosis. Our recurring sketchy symbol for renal tubular acidosis is test tubes filled with acid. And here we see an angry parent testing the acidity of the park grounds before he lets his children set foot inside. Looks like he's not too happy with the result. 4 test tubes of acid depict RTA type 4. Remember, this is the only renal tubular acidosis that has an associated hyperkalemia, which is why these 4 test tubes are forming the shape of a big K. All right, the last side effects to discuss are associated specifically with that health inspector, spironolactone. While the eplerenone teacher is selectively grabbing that Mineralacort key holder by his cheap polo shirt, spironolactone is much less selective for the mineralocorticoid receptor. The spiral-bound spironolactone health inspector has even bigger fish to fry. It turns out that spironolactone is a synthetic steroid that can wander around and bind to other steroid receptors and processing enzymes. Spironolactone has anti-androgenic side effects due to its ability to block testosterone synthesis, for example. Yep, looks like another health code violation at the old onion ring fryer. Let that bubbling high cholesterol fryer producing a crispy male symbol onion ring remind you of the production of steroid hormones like testosterone from cholesterol. Spironolactone blocks 17-alpha hydroxylase, or ferhydroxylase as this appliance is called, an important enzyme in the testosterone synthesis pathway in the adrenal cortex and gonads. Take a close look at those 2 bubbling pots of oil and notice their uncanny resemblance to 2 bilaterally enlarged polycystic ovaries. Polycystic ovarian syndrome is a disease characterized by excess androgen production by the ovaries and insulin resistance that often presents in adolescence. If symptoms of androgen excess, including hirsutism, persist after a trial of oral contraceptive therapy, patients can be started on spironolactone. We've even included a big, great bushy beard on the fried food station worker. It should remind you of spironolactone's ability to treat symptoms of androgen excess, including hirsutism. Spironolactone can also bind to and inhibit the androgen receptor directly. So the health inspector grabs onto this eager kid who was about to grab that tasty testosterone treat. Although the anti-androgenic effects are useful in the setting of polycystic ovarian syndrome, in other settings they may be undesirable. Just take a look at this surprised fryer operator holding 2 pot lids over his chest, which should remind you of gynecomastia caused by spironolactone therapy. And this poor young lad holding a floppy, sad-looking churro should remind you of other unwanted side effects of spironolactone, including impotence and decreased libido. You didn't think there was a way to completely ruin the joy of a churro, did you? That just happened. And on that note, I say we sum up this sketch. The collecting duct is all about absorbing sodium and kicking out potassium and protons, all powered by those mineralocorticoid keys. To keep sodium in the tubular lumen and potassium in your body, you can either block aldosterone or block the apical sodium channel normally activated by aldosterone. The parents wielding the triamptorine tangerines and amiloride almonds go for the latter. By inhibiting ENaC, they promote sodium excretion, and the resultant positively charged tubular lumen keeps potassium in your body where it belongs. Watch out though, because the proton follows potassium, and these agents can cause a type 4 renal tubular acidosis. The eplerenone apple-loving teacher blocks the aldosterone receptor to produce similar effects. The spironolactone spiral-bound health inspector also blocks the receptor but is less selective and can inhibit androgen hormone synthesis as well as block the testosterone receptor directly. This can be helpful in polycystic ovarian syndrome, but not helpful if you're looking for a firm, crisp churro. Spironolactone and eplerenone's ability to block aldosterone is used for treating hyperaldosteronism, of course. However, they can also save lives in heart failure by blocking aldosterone's activity and preventing myocardial remodeling. Well, I think it's about time we got out of here. We rode on one bicarb race car. We got covered in battery acid, allowed said battery acid to sink in as we waited in line for the loop-de-loop, giving up and waiting in line yet again at the high dive, pasty thighs, underwhelming fried foods. Yep, sounds like one of my better days at the Nephron Fun Zone and Water Park to me. Ooh, yeah, and on the way out, we can find a bathroom somewhere. I have literally been holding it this entire time.